ಬರ್ತಾ ಇದ್ದೀರಾ for Gadag?
ಇಲ್ಲ I told it is not possible. ಯಾಕಂತ ಹೇಳಿದ್ರೆ one is distance and the one is that time we are here having the Independence Day celebration and all that. I can't leave.
I know.
Yeah.
And it takes about 2 days for you to come to Karnataka, this part?
Yeah. So one day I'll be reaching in Bangalore. The next day only I have to take to Hubli flight and then from there Gadag. Yeah, it's too much. Good evening, ma'am. Vidya ma'am. Vidya Tobi ma'am.
Good evening.
Vidya. Hello,
Namaskar,
Chairperson, Kcog. Vidya, my friend.
Yeah.
Nice to see you here.
Nice to see everyone. Yes.
Good evening, Madam Vidya.
Yeah. Welcome to I am welcoming everyone. So many people have joined.
Yeah.
Varsha is so popular.
Yeah, Arun, we can start off.
Yes.
Okay, sir.
Shall I start, sir?
Yeah.
Ellarigu namaskara. A hearty welcome to this program of the monthly sessions which we all eagerly look forward to, conducted by Dr. Muralidhar Pai sir, that is the Cpap program, as a part of the academic teaching wing of Kcog. My respects to all the seniors in the faculty and our mentors, Dr. Hiramad sir, Dr. Hema Divakar ma'am, Dr. Vidya Bhatt, Dr. Muralidhar Pai sir, and our special guest for this evening, which we all are looking forward to very eagerly, Dr. Varsha Baste ma'am, and our dear President, Dr. Vidya Tobi ma'am, Suman Gaddi, my friend, and Shobha Gudi ma'am, who is present here today. I welcome you all for this wonderful session of learning, which keeps on motivating us to join at 7:30 dot on the Thursdays to see what new we get to learn on this evening. Welcome you all, sir, and welcome to all the faculty who have joined in and logged in to be a part of this listening and learning. Ma'am, over to you for your remark as a president.
Yeah, I really am very much pleased to welcome Dr. Varsha Baste here. And I'm very much thankful to Dr. Muralidhar Pai. He brings out best in every speaker, I must say. And we always get inspired by his talks also. So I keep on referring Dr. Muralidhar Pai to my postgraduate students also. So he has got very innovative ideas and he has brought this platform to a different level, I must say. Today we are going to look upon Dr. Varsha Baste. She will be talking on newer updates in stem cell therapy in infertility. We all know Varsha, such a great human being, my great friend, and maybe she will be talking about the stem cell therapy in infertility in a different aspect. So I will not take much time. We'll listen to her and then we can conclude the session by various comments also. So thank you very much, Dr. Pai, to call Dr. Varsha Baste here. And I think Dr. Suman will be introducing her, or Dr. Pai will be.
Arun, can we ask Arun to play the invocation
song and then we will introduce. Yes.
Yes, ma'am. Shall I start, ma'am?
Yes, please.
कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तुते दीपज्योतिर्नमोऽस्तुते शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः.
Thank you, Arun. I now call upon Dr. Muralidhar Pai sir, the Dean of Kcog, to please introduce our esteemed guest for the evening, Dr. Varsha Baste ma'am. Over to you, sir.
Yeah, good evening, friends. Today we are celebrating the 3rd anniversary of Cpap. We started it during COVID in 2020 June, and today it is 2023 July. Continuously every Thursday we had of the first Thursday of the month. But couple of Thursdays we missed because of Kcog conference. So this is probably 34th in the series. And we have been fortunate to have very good speakers month after month. And today we have yet another excellent speaker, clinician in Dr. Varsha Baste. Arun, can you please put up the CV of Madam? Dr. Varsha Baste has a 30 years experience as practicing gynecologist and infertility specialist. She's the first one to give ICSI and PGD baby in North Maharashtra as early as 2003. So that speaks volumes about her commitment to the field of gynecology as well as infertility. She is the director of Baste Maternity Hospital and Pushpa Fertility Center. She has been the past president of OBGY Society Nasik in 2014. And the most recently, we all know her as the chairperson of FOXY IAEC, which concluded just last year. And she got the FOXY Excellence Award for outgoing FOXY chairperson. I think along with Dr. Vidya Tobe Madam also, she also got outgoing FOXY chairperson award. And chairperson of FOXY IAC, she has done lots of webinars and workshops, and I myself have been part of many of them. She also won the prestigious Dr. Anandi Bai Joshi Award, as well as AMOGS FOXY for Sri Pushkar Puraskar by Honorable Governor of Maharashtra. That is a great honor that she has received. She has participated in numerous national and international conferences. And this year particularly, she has been running a marathon academic programs all over. She has organized many national and international conferences herself. And she's the founder member of MSR, Maharashtra ISAR, life member of IAGE, fellow of ICOG and FICOG. She also has diploma in infertility, Kiel University, Germany. Today's topic is a very, very important and very recent topic. I myself am very eager to listen to you, Madam, about the role of stem cells in infertility. So without standing in between you and the audience, I request you to please give your lecture now. Thank you, ma'am.
Can I add a sentence?
Thank you so much.
Please.
It's been a wonderful journey with Dr. Varsha Baste ma'am that we all are introduced to Rajyog sessions, which happen very sincerely, dedicatedly. And just like our Cpap program, not a single day has been missed on Saturdays morning between 7 to 8. She has introduced all the interested Foxians to a wonderful way of health and happiness. And then we find so much of change in the overall outcome and overall behavior, performance,
Attitude,
and health for many who sincerely log in on Saturday morning between 7 and 8 to the Rajyog session conducted by our dear Guruji called Avinash Pankar. So very thankful for that, ma'am. Your credentials above all is to be a true Rajyogi. Thank you so much.
Thank you, Rajeshri, for that extraordinary input.
Thank you, sir.
Thank you, everybody. Thank you so much for inviting me, Dr. Mulidhar Pai, Kcog, the academic wing, Kcog, Cpap program, Dean Dr. Hema Diwakar, Chairman Dr. Mulidhar Pai, Vice Chairman Dr. Sajjan Sir, Secretary Madam Dr. Vidya Bhatt, and Kcog Office Bearer Dr. Patrons Dr. Hiremat Sir, Nagaraj Sir, which I had made last year, Dr. Vidya Tobe Madam, the dearest friend of mine who is the chairperson, and Dr. Rajeshri Polodi, dearest friend of mine, the secretary, and Suman Gaddi Madam, the president treasurer. I bow in front of all of you for giving me the opportunity to talk in front of this August gathering. And let me start by sharing my presentation. Can you see my slides?
Yes, ma'am.
Yeah. The volume is okay now?
Fine, ma'am.
Yeah.
Fine, ma'am.
Yes. So my topic is little futuristic. You may feel it is futuristic, but I have been using it both autologous and allogenic stem cells. And I started my Cellgen anti-aging center in late 2015. And there were many appeals, and it is a really recent subject. So every 3 months, the treatments, the schedule used to change, but it has given me very good knowledge, and still I'm exploring it. So my topic is newer updates in stem cell in infertility. Trends. Stem cells versus exosomes. Now, many of you may not be knowing this name also. We are gynecologists and we are not the stem cell therapists, but it is used nowadays in infertility or many regenerative conditions. Stem cell therapy involves guiding stem cell into becoming specific cells in the body. They are found in several places like embryos, umbilical cord, adult bone marrow, and fat. In stem cell therapy, what we do is donor stem cells are placed in your body to replace and repair diseased cells. Stem cells grow and divide for a long time. Stem cell has two conditions. They have two specialities. They multiply, and at the same time, these totiprotein, multiprotein cells, they get differentiated into more than 200 types of stem cells, 200 types of cells in the body to go to do the healing or repair. So the treatment gets your body started on healing process, and then it continues to create healthier cells over time. Now, exosome therapy. Unless stem cell therapy, exosome therapy doesn't involve using donor cells in your body. Instead, they are extracted from donated human mesenchymal stem cells and sterilized. Exosome solution contains valuable lipids, messenger RNA, microRNA, signaling cytokines, proteins, and this therapy can be administered through IV injection or by directly injection to the target area or treatment area. Exosomes are powerful elements that can restore cells throughout the body. They enhance cell-to-cell communication, which is very, very essential for overall cell health. And this cell-to-cell communication is lacking with more aging or more damage to the cells. That is restored with the help of exosomes. Compared to adult stem cells, exosome contain nearly 3 times more amount of growth factors, and more growth factors means better ability to restore and revitalize target cells. So unlike stem cells, exosome therapy doesn't involve using donor cells. This is little futuristic, but it is practical also. What are exosomes? They are extracellular vesicular structures secreted by all cells in culture and found in body fluid, that is an exosome cargo. The exosomes are involved in different biological processes which include antigen presentation, apoptosis, angiogenesis, inflammation, coagulation. They activate signaling pathways and deliver nucleic acids to distant cells. They are nano-sized structure. They are found in semen, epididymal fluid, endometrium, as well as in follicular fluid. Exosomal cargo was related to fundamental changes in implantation, adhesion, migration, invasion, and extracellular matrix remodeling. They contribute to endometrial embryo interactions within human uterine microenvironment, which is essential for implantation. So this is a typical exosomes which are secreted in the extracellular fluid. Let us see how exosomes act. See, the soluble secreted factors and exosomes are released by the endometrium in the uterine microenvironment, which influence the blastocyst. This is the glandular epithelium, which secretes all these exosomes and soluble secreted factor. Then this trophectoderm, they are released by this glandular epithelium, and trophectoderm enable the blastocyst to undergo apposition, attachment, and invasion throughout the endometrial epithelium and the luminal epithelium. Mediated by exosomes released from uterine endometrium that transport signaling molecules such as microRNAs. This is crucial during implantation and embryonic development. So this particular microRNA has been determined and can be used as a marker of early pregnancy. An increase in contents of exosome in placenta or circulation in women with eclampsia and preeclampsia. So exosomes are different in different condition. In stress, the different exosomes are secreted from the cells. When the patient is having eclampsia or metabolic syndrome, the different types of exosomes are secreted. So they are different than compared to non-dysfunctional women was detected. And that suggests that early detection of complications and pathologies of pregnancy by examining exosomes may be a prophylaxis and may support the implementation of treatment. So the extracellular vesicles act as vehicle for cell-to-cell communication. The extracellular vesicles are secreted by cells into extracellular space, and they are microvesicles, exosomes, autoptotic bodies, and membrane particles, and ectosomes also, endosomes also, exosomes also, and but all differ in different release pathways, biogenesis, function, content, and size also. So what is the role of exosome in female reproductive system? It acts at every stage of the follicular development and helps in implantation if it is secreted in a proper way, and it helps in healing, regeneration, and reproduction also. So it helps in growth of follicle, oogenesis, embryo development, implantation, oocyte maturation, communication between endometrium and embryo, endometrial reactivity, reduce cumulus cell apoptosis, preparation of uterus for implantation, quality of female gametes, ovulation, granular cell proliferation, and proper fertilization. So it is needed for each and every stage for reproduction. Now, endometrial epithelial cells are released exosomes that are important component for interaction of endometrial plastosis interactions within uterine cavity. Just now we have seen how it is done. Exosomes are related to fundamental changes in implantation, adhesion, migration, invasion, and extracellular matrix remodeling. Functionally, exosomes are internalized by human trophoblast cell and enhance their adhesive capacity. So, exosomes contribute to endometrial embryo interaction within the human uterine microorganism, which is essential for successful implantation. What about exosomes in ovarian follicles? Mature ovarian follicle contains an oocyte that is surrounded by several cell population. This follicular fluid of plasma and follicular cell secretion contains a variety of components including protein, hormones, and exosomes. Follicular fluid is involved in communication between oocyte and cumulus cells, which influences oocyte maturation and modulates meiosis in female gamete, and it also affects the conception and possibility of embryo implantation. So exosome contained in follicular fluid affect the quality of female gametes, limiting apoptosis of cumulus cells and support conception. So what are the benefits of exosome therapy? This is highly targeted, highly sophisticated, highly delicate, highly sensitive, highly fragile treatment with exosome therapy, because it is highly sophisticated to procure them from the stem cells, and it is very difficult to stabilize them. They have less half-life also. So we need to have a very standardized, highly technical stem cell lab and stem cell scientists also who can procure them for us as clinicians to use them. So it is a flexible treatment for conditions like osteoarthritis, chronic pain, musculoskeletal injuries, or disorders, chronic degenerative problems. The genetic disorders, chronic and degenerative disease, and natural aging process can also inhibit your cell's ability to communicate. And what do? Exosome therapy improves these communication channels between cells to stimulate healing. For example, osteoarthritis is an extremely common degenerative joint condition. We all know stem cell therapy can provide regenerative benefits, but results can be limited by external factors and your oral cell health. Exosome therapy supports healing by providing additional information from younger cells that your body needs. So it needs very strict protocol to manufacture or extract exosomes. The quality and sterility requirements are very, very high. They cross blood-brain barrier. That is a very good advantage for maximum efficacy, and they have low risk of clumping. They are used as anti-inflammatory, antifibrotic, and very easy to administer. Friends, I started my cell gene anti-aging center in late 2015. I have the setup. I am a trained stem cell therapist. I know how to do the passage and all everything. I was the clinical director also for one this cord blood banking stem cell bank. But that time what we used to have that machine. I used to procure this bone marrow from this posterior superior iliac spine, and then the automated machine used to segregate the hematopoietic mesenchymal stem cell, and then we used to use it for this Parkinson's patient. Intrathecally we used to give them. Few patients, 30% patient used to get good result. But what was that the stem cell doesn't cross blood-brain barrier. And it used to give us result, but it was not that much what now we are getting, because in these exosomes cross blood-brain barrier, because the body has to do scavenging effect, also the scavenging method to reduce the protein, the cell mass also, and to remove the debris also. The body has to do overwork of removing these dead cells, stem cells, which are used after some time. And this is not the case when we are using exosome, which is highly purified and highly potent and highly sophisticated treatment. When there is a science of sophistication, it becomes simple. But the logic of making it simple is not that simple. Much of the research and studies go behind it. So these are the signal pathways involved in communication in ovarian follicle. Functions. Exosome can influence the function of ovaries by supporting expansion of the accumulation, modify the expression of their genes. Exosome in human follicle fluid containing microRNA are involved in regulation of biological pathways critical for dominant follicle growth and oocyte maturation. So this communication between ovarian follicle and cumulus cell is very crucial for follicle maturation to produce oocyte capacity capable of fertilization and support embryonic development. Now, extracellular vesicles are ectosomes also and exosomes also. Exosome cargo that likely to remove excess or unnecessary constituents from cells to maintain cellular homeostasis. What are the advantages? They are associated with no immune response, because there no cell is there. So devoid of immune responses, related diseases and cancer production. Cancer cell develop different types of exosomes. So that is different types of cell, but we can diagnose it with examining how much and what exosomes the cancer cell and how, and then we can know also the cancer progression. Proteins metabolites nucleic acid derived by exosome in recipient cell effectively alter their biological response, which may promote or restrain disease. We have seen just now exosomes in uterus. The implantation of embryo in uterus depends mainly on proper communication between endometrium and blastocyst. Also prostaglandins and interleukin. We all know different types of interleukins are there. Endometrial reactivity and readiness for embryo implantation also result from participation of exosome in communication process originating from endometrium and embryo. Moreover, exosomes in uterine fluid that contribute to increasing the proliferation of uterine endothelial cells at the site of implantation. This particular microRNA contained in exosomes are involved in implantation by regulating gene expression during this process. So what are the challenges and what are the clinical applications? But there are challenges. The disadvantages of using exosome is that they can be damaged during isolation and purification. It is, I told you, it is a highly fragile, highly delicate, highly standardized and highly sophisticated procedure to procure exosome. You have to have a scientist who can give you good amount of good quality exosomes. And then your result depend on that. The lifetime of exosomes in blood fluid and their stability is also an important issue. So the good scientist knows how to stabilize them, how to prolong their half-life. They are stored in less than under 20 degrees temperature. A minimum of 10 to 100 microgram of exosome is required for therapeutic dose. But the problem is the yield from 1 ml of culture medium, which is essentially less than 1 microgram. So another factor which also influence retrieval of the exosome are composition, volume of the culture media, cell passage, that is 0, 1, 2, 3, 4, 6 cell passage, and their viability. So if you want to have good exosomes in good quality and potent, then you have to use the fibroblast of 0 passage. And the use of exosome in regenerative medicine reduces the risk of unwanted side effect that has been associated with cell transplantation. Research have shown the lack of induction of immune response of organism in exosome therapy. Currently, they can be used as biomarkers in the diagnosis of many reproductive diseases. Identification of exosome as markers will help to understand fertility disorders caused by dysfunction of sex organs and glands. The use of exosome in therapy as drug carriers seem to be the future of treatment. Now, how do exosome therapy differ from PRP? So, Maruti, this PRP is a crude method of separating growth factors. It is a good method, no doubt, but it is a crude method of separating growth factors which are bound to platelets along with other cellular debris, which is used in speculated time. I have used lots of PRP. We are Indians, so what we do, both kame, but we lack in publishing. I have all the data, but we have not. I lack in publishing it all. Exosomes more potent, rich more in growth factors, messenger RNA, microRNA, DNA, proteins, nucleic acid, and far more refined and potent than PRP and more effective. They are derived from mesenchymal stem cell harvesting, and also that is allogenic. And also autologous stem cell you can also have, but it is more costly and time consuming, but it can be possible if the patient wants it to use autologous. Exosome can be used for therapeutic control of many diseases, including neurodegenerative conditions and cancer. They alter bioavailability of a drug to aid in disease diagnosis. You can take samples of biological fluids, liquid biopsies to diagnose the disease. Disease progression and response to therapy can be ascertained by analysis of exosomes. So how to get exosomes? Many kits are available, long centrifugation, isolation, etc. How to collect exosomes, isosomes. The isolation of exosome from biological fluid with centrifugation, filtration, chromatography, precipitation, immunological separation is done. But this is not our forte. We are clinicians, so we know how to use it, but we cannot procure. That is the work of trained stem cell scientists. Now, can we buy exosomes? Currently, no FDA approval for exosome products. They are under still trial and research. Friends, this is for the sake of it. I have written it. It is a fact. But do you know, stem cells also are not FDA approved, but there are centers all over India, all over the world. They are giving stem cell therapies. Cord blood banking is done. Cord blood, all these stem cell therapies are, there are big hospitals also. It is not FDA approved. The same way exosomes are also not FDA approved, but we are using it. No doubt, it is a recent, it is a one stage up of stem cell use. So the trials are still going on. Are they better than stem cells? Definitely. Compared to other stem cell, exosome contains 3 times more growth factors. They are powerful elements that can restore cells throughout your body. They enhance cell-to-cell communication. So they are very good for anti-aging treatments or metabolic syndrome or chronic diseases or nerve disorders, which is essential for overall cell health. More growth factors means better ability to restore and revitalize target cells. Every cell produces unique exosome with unique characteristics and contents. They are produced for cancer cells are likely to lead more cancer. Exosome produced from stem cells are likely to promote anti-inflammatory regenerative activity like their originating cells. And with stress and all, they get affected. So hypoxia, reduced nutrients or stress stimuli produce the exosomes of different contents, and different cargo messages, culture condition and timing also impact the type and function of exosome produced by the cells. So by trial and error, and then by this, it is the forte of the stem cell scientists how to produce them and what type of requirement we have. We have to discuss it with the stem cell. We are stem cell therapists and they are stem cell manufacturer, the stem cell scientists. So each person has different number of exosomes, perhaps different type of exosomes and cell culture media, which affects this glucose, amino acids, vitamin, inorganic salt, serum. This is not our our area of interest, but we should know how they are prepared and how they are being extracted. And so we can discuss with them. We have to, with each case, we have to discuss with the stem cell scientists how much concentration I need. If it is acute problem, the patient is having acute inflammation and very acute problem, then the dosage needed is more than normal. That like 2 million cells per ml we as the stem cell scientists to procure from to get those many exosomes. And if it is a chronic disease, less doses will be okay. Then 1 million per ml these fibroblasts are harvested, and from them we get that much concentration of exosomes. So this is a mesenchymal stem cell, which from which we can get these many immune factors and these many growth factors. So what is the role of exosome in male now we have seen the female. Now male in reproductive system, semen is a mixture of secretion of testicle, epididymis, prostate, seminal vesicles, which has sperm cells and seminal plasma. Seminal plasma is a key factor for sperm maturation, capacitation, acrosomal reaction, and fertilization. Moreover, it contains exosomes. And the prostosomes are abundant exosomes in seminal plasma from prostate epithelial cell. They regulate cell sperm motility. The seminal exosome, which are 3% of semen plasma protein, they also protect sperms in acidic environment of vagina. Moreover, prostosomes have the ability to modulate sperm motility, capacitation, and acrosome reaction to prevent premature sperm capacitation. So what is the role of exosome in male reproductive system? Protection against sperm oxidative stress, morphological and biological changes in sperm cells in epididymis, fusion with oocyte, acquisition of fertility ability, development of gametes, sperm maturation, modulation of sperm motility, capacitation, acrosome reaction, protection of sperm in environment and in female reproductive system, which is acidic pH, and protection against premature capacitation. So there are different for each and every stage. Stem cells, these exosomes are important and they play an important role. So friends, I have stopped using PRP, but this is a highly sophisticated, so the cost factor is also there. So we want a middle one. So what is it? That is a cyanakin. We many of you may be knowing that it is the activated autologous cytokine release serum. So instead of PRP or instead of this thing, we can use this also, which is more cost effective for patient who cannot afford it. It is giving good results to stop inflammation and support regenerative process. Body's own serum autologous without trace of any cell is obtained. The kits are available. We have to induce inflammation to get more releasing of cytokines, which are mainly growth factors and interleukins, very high concentration than PRP. It is a plasma without fibrinojone. They all boost for endometrial receptivity. We are injecting it for the patients having low AMH patient to develop more oocytes. If injected in origin laparoscopically or transvaginally. So we in this lab we process the activated cytokine rich serum, which is used for the same way what we used to inject in laparoscopically the homeopathic bone marrow derived stem cell in the ovaries, or for Asherman syndrome after operation we used to inject this homeopathic stem cell. The same way, alternative to it is also this activated cytokine release serum. Exosomal cargo is a key player in establishing the diagnosis and executing therapeutic role while regulating a disease process. So thank you for your patient hearing. This is my lab and this is my hospital, and from where I come from, Nasi. Dear friends, at the last, I would like you to appeal for giving me the chance to serve for Foxy. I'm going for the position of Foxy Vice President West Zone. Please help me, bless me, support me, guide me, and मेरा चेहरा देखना और सिक्का मारना. Thank you for your patient hearing.
Thank you, Dr. Varsha. It was really, what should I say? The really recent advances that you have touched upon very nicely. Just wanted to ask a couple of questions that have you used it yourself? These exosome injections, are they available?
Very
You said
good
it is
question.
FDA not approved.
Yes, very good question, sir. See, what is that? You have to have a good contact of a stem cell lab, and also a very good rapport with a stem cell scientist. So I'm fortunate for that. He is already the HOD of the stem cell college. So it is all no question asked about his authenticity. And for I used to do mesotherapy, all the skin treatments, beautification, hair. I like to do different things, and with good results. I used to write lots of papers, and so many patients I used to get for 2 years. I really was flooded with work. But then I reduced it because the laws came and all. I really want to abide with the laws. So instead of allogenic, I started with autologous, and autologous has little limitations. But to get the good results, we have to use allogenic. So the lab gives me the allogenic also, depending upon the patient condition and all. The more fetal cells you use, more in concentration if you use, for even if for rheumatoid arthritis and all, it has given me fantastic result. My sister-in-law got pain relieved of knee joint pain. She couldn't walk now. She means good results patient could get with hemopathic autologous stem cell. I have used them, and also for this exosome when it started, that my daughter delivered, and we have preserved her umbilical cord, and from there autologous derived exosomes I procured for myself, and I took it for myself also. So it is like our genetic stem cell bank also. So it is I have tried everything, whatever is for myself, and then I use it for patients. It is not that I want to do anything irresponsibly. No, not like that. We take sittings, we do counseling, we read. Then I have a very good rapport with the stem cell scientist. Then we decide what to do, how much, how many injections, how much is the percentage of concentration of exosomes to be given. Previously, I used to give stem cells. Now I am using exosomes, and I have very good contact or sourcing of the lab who gives me. Many of you may not be having that sourcing. I am fortunate to have that, and I'm continuing with that work.
Yeah. At what stage in, see, because your talk is on infertility, at what stage of infertility treatment you give these cells and how many doses? Is it per cycle?
Yeah,
or
that's a good question. See, I use stem cell means exosomes depending upon patient's pocket. If they are ready to spend, then I use exosomes. If they are not ready to spend, then I use activated cytokine serum. If they are in between, I use homeopathic stem cell, because I have my setup. I have Cpap machine which segregates the autologous homeopathic stem cell also. But I want to do lesser invasive therapies, because we have to remove the bone marrow. Even if I was initially we used to do lots of cases, but now I'm more conservative. I want them to give good result, but with less intervention. So now I'm relying more on this cytokine-rich serum, which gives me the same effect like cytokines and growth factors and nucleic acids. So for Asherman's, we used to use homeopathic. Now we have shifted to this this thing. Even I am using this segregating these lymphocytes also. That technology also I have. We are giving immunotherapy for recurrent implantation failure, IVF failure means, and the recurrent abortion, RPL patients also. If the patient is elderly, any problematic patient, something is high risk, I give it to them, and then from next cycle we start giving them the treatment. And up till now the results are fantastic. Means I assure patient that it will help. We will try, but I do not say it is 100%. But it has, this cytokine serum has given me 100% result so far. But I do not say that it is 100%. I cannot say that. But definitely this immunotherapies, fertility sterility journal has banned, not banned, but it has declared in 2017 no role of immunotherapies. Even ACRA declared no role of immunotherapy. But we are doctors, we are using practically. When we are getting results, why not to use? Because we are doing all the work in the interest of the patient to get good results. And these immunotherapies of segregation of these lymphocytes gives me fantastic results. Very simple. The technology one should know. It doesn't need too many machines and all. It needs the knowledge how to get it, the science behind it, you should know. And the person who can give you that technology, you should have access to that. So that is very important.
Okay, my last question before I hand over the question and answer session to Dr. Rajeshwari is that what's the cost? You said it all depends upon the cost, affordability.
Yes, a good question.
So what is, what's the cost of exosome? What's the cost of stem cell? And what's the cost of MRCL?
Yes, this I will start from less. This Sanakin, the kit cost is around 2,500 rupees. So we take around 20,000, 22 or 25, depending upon the patient's condition, whether we have to inject it in ovaries or just in the endometrium, depending upon that, the cost factors 2 to 5,000 either udhar hota hai. Then for this autologous homeopathic stem cell, because the kits are there, the machine is around 25 lakhs. When I bought, now it is almost 48 lakh machine. So the cost of everything, the hardware, what you say, or software also. So that we have to take it account. So we used to cost, we used to charge 1.5 to 2 lakh depending upon the patient's condition, laparoscopically if you have to inject and all. The exosomes therapy, they cost from 50,000 to 2 lakh, depending upon the how much concentration we are going to use, how many times the injections are given. Even we are using the placental extract also. Which also have good stem cells. So sometimes we use, they give good result because we have to increase the cell-to-cell communication. The pathways should be aligned. So that that is done by all these injections or IV injections, exosomes. Accordingly, we charge it. And
thank you.
Sometimes we get miraculous results, sometimes we do not get, but definitely it doesn't go waste. So Sanacan is better for patients cause patient this thing, and this lymphocyte segregation, hardly we charge 15,000 rupees and maximum 25 depending upon patients how many times we have to do it. If 2 times 25,000, otherwise one cycle 15,000 only we charge, because the technology we have and the results we give, it really helps the patient when the cost is reduced and they are ready to do it only in the endometrial cavity if you want to inject, but for laparoscopically if you have to inject, the cost increases little more.
Thank you very much, Dr.
But this lymphocyte segregation we do exclusively only for endometrial installation.
Okay. Dr. Rajesh, you can take over the question and answers session. If
Yes,
there are
sir.
any questions in the chat box.
Yeah, I see some questions in the chat box, and at the outset, I would like to thank Dr. Varsha Baste ma'am for bringing in new inputs regarding the therapy that we have, which is quite futuristic, as you have said, and gives a ray of hope for many aspiring to have better skin and better fertility rates. Thank you so much. And there is one question from Dr. Anil Kaur from Hyderabad, who asked, I believe women are using IV injections for anti-aging on a regular basis. What are the side effects?
It depends on from where you are getting and or what product you are getting. But generally, these if you take glutathione and all, it is available in gray market. It is giving good result. But why is it available in gray market? Because there must be something hidden problem of glutathione which is not available regularly. But tablets are also. So if it depends, vitamin C, glutathione, the combination cocktail is given IV. It's okay if you are taking vitamin C, it doesn't harm. Glutathione, it depends on person to person. So it depends on person to person. If he is sensitive, she should not go for that. Exosomes, if you take, there is no side effect of exosomes. It is highly potent, highly sophisticated, very good. Mesotherapy and all, it gives good result, but the cost factor is there, definitely.
Thank you, ma'am. I hope Dr. Anil gets her answer. We have compliments from Dr. Yukti Bhadwaj, Dr. Shobha Gudi, Dr. Poonam Patil, who say that it was a very useful talk. And Kumudi Jha asked if it can be useful in mental retardation and epilepsy.
Yeah, see, I used to get many patients, CP patients mainly. Lots of patients used to, with my, when they used to come with the babies from Pune, Mumbai, all over Maharashtra, whatnot, even from Andhra Pradesh, I used to get so many patients because of my article. But there are limitations for everything. CP babies are getting good results, but I do not treat those patients which are more chronic or more challenging cases. I do not do. I have restricted. I used to do the nerve disorders treatments previously, but now I have restricted my treatments to mainly infertility and little bit of anti-aging. That too, if I want to do take the patient, then I take by selection. And Mary Marzi hai to leungi nahi to nahi. It is like my it depends. I should say it depends on my mood, but I say I play safe nowadays because of all the laws and everything. I do not want anybody to sue me. And so previously we did everything, no CP baby, mental retardation. We didn't take any case because we are not gods, and this science is not very proved कि वह ऐसा ही होता है. Still the research is going on. So we shouldn't boast of giving हाँ आ जाओ इतना पैसा भरो और treatment ले लो, नहीं हुआ तो what can we do, आपका कैसे अलग था. Nothing like it. Our conscience should be very clear. We want to help the patient. If we can, I tell them 30% result मिलेगा तो चलेगा, तो we will take it, otherwise not. But not many like mental retardation, CP babies, they should go to the stem cell research the centers. They are giving the treatments, but too much of problem. They are also giving little less at a time, and 8 to 10 sessions patients are taking so much of money and whatnot. So I do not want to discuss it also here, but many exploitation is done for such patient because they want result, because they are very desperate. And I have restricted my work only on infertility, which is giving me result also and satisfaction also.
Thank you, ma'am. That was quite elaborate. Dr. Shobha Gudi has a question as to what is the percentage success in recurrent implantation failure, and you must have used in these cases for endometrium.
Yes. Recurrent implantation failure, up till now, whatever I have used, I tell you, almost all patients have got good result with the lymphocyte therapy, segregation therapy, what we call immunotherapy. The problem is that the patient shouldn't have too many, means thin endometrium, means tuberculosis patient. The infection part, if it is more, it gives less treatment, less what is a result. But when then we give 2 to 3 cycles, then it gives better result. But that I will say more than 80% patients do help get benefit of RPL patients because of this thin endometrium patient or IVF failure because of endometrial problem. And, they get very good result with these therapies. Sanakin therapy, very good, cost effective. Patients are ready because they come. And now my center is 20-year-old. I do not get fresh patients. They can repeated implantation failure, repeated IVF failure. Such patients come. So generally we give them these immunotherapies or Sanakin therapies, and then we take it and they get good results.
Wonderful, ma'am. It sounds very promising.
And in one or two cycles.
Wow, nice. Definitely, it's a great promise for those who are willing to have fertility treatment care for the repeated failures and RPL and implantation failures. Doctor, there's another question by Dr. Anjali. No, she compliments. She says, very exciting deliberation. And Dr. Ritunanda, excellent deliberation, ma'am. And Dr. Shobha Gudi has expressed her thanks. Sir, I think we come to the end of this interaction and question answer session.
Yeah. So I thank once again Dr. Varsha for throwing light on this something new, hatke. I mean, it's hatke from routine. And it was interesting. In fact, I was also enlightened today about this new thing like exosomes. I still wonder how they think of all this and how they learn to extract all these things. Really wonderful. And
you can have a talk with my stem cell scientist, sir, so he can give you more explanation and all how he does it.
So actually, years ago in Manipal, we used to give this platelet extracts those days, for the RPL, but then it became unpopular in the world, as you said. It was banned as well. It can be more dangerous, they said, so we stopped that long back. But again, now when the purified forms, when it comes, probably it has got less side effects. That's why it is probably useful. Thank you very much. If there is no other questions or comments, I request Dr. Suman Gaddi to propose vote of thanks.
Okay, sir. Thanks for this opportunity. And first of all, I would like to thank the entire Kcog team, Dr. Hema Devakar, who's the dean, Dr. Muralidhar Pai, who's the chairman and was convener for today's webinar, Cpap. Also thank Dr. Basura Sajjan, vice chairman, and Dr. Vidya Bhatt for their constant efforts in moving forward with the Cpap programs. I thank the entire Kcog team led by Dr. M.J. Hermot, who's the chief patron, Dr. Nagaraj, senior patron, Dr. Vidya Topi, president Kcog, Dr. Rajshri Paledi, secretary general, and president-elect Dr. Bharati Rashekar. Dr. Shobha Gudi, I thank her also for gracing the occasion and interacting in today's webinar. I thank today's speaker, Dr. Varsha Baste, for a very, very interesting recent advances in infertility pertaining to stem cell therapy. And madam, you were really, really wonderful, great talk, really innovative. I thank all the EC delegates for joining and making this webinar a successful one. I thank Mr. Arun for providing the Zoom platform for today's webinar. And of course, thank you one and all. And Madam Varsha Baste, all the best for your the post of Vice President Foxy West Zone. Thank you one and all.
Thank you, sir.
Well,
Thank you so much, Kcog.
We wish you all the best, and we wish you the success as well. All the best.
Thank you so much, all my dear friends. Yes. And Dr. Muralidhar Pai, I really am obliged for giving me this opportunity and such a nice platform. So I'm feeling so excited. All my friends, I can see they have joined and whatnot. Dr. Rajashri Paladi, she's a staunch devotee of Raj Yoga, and her life has changed a lot. That is what she always tells me. I was only the catalyst, but she is the good student of Guruji. It's not my credit. And Dr. Vidya Thobi is also so lovely friend from since ages. And I miss Kasturi also here, and I can see many my friends. But I cannot take their names; it will not look good. But I want to thank Dr. Suman Gaddi, Dr. Rajashri Paladi, Dr. Vidya Tobi, and Murlidhar Pai sir for giving me this opportunity. फार से देखो मेरा चेहरा देखो शिक्का मारो for Vice President Poxy West Zone. Thank you so much.
Thank you, ma'am.
Shabba khair. Good night.
Thank you so much.